all came in fresh. We're saying, what is this all about? You say I'm going to change, you say you're going to help me, you say we're going to have system redesign and process improvement. But how are we going to do that? So we offered them different learning modalities. By that, they could come in and go from a very complex, time-consuming learning to a web-based. So they could come and join us at collaboratives, which were 2-day events, a lot of knowledge transfer, but a lot of time for the teams to work together and start to understand what it is they're about to embark on. Other teams joined us via what was called knowledge transfer, which was a smaller version, maybe a 1-day session, where they had a lot of information coming to them again to go home and digest and work with. Other teams worked through web-based learning, and then the fourth modality was just to have a coach, someone like myself, Sally, that does work with them and try and put everything from the 2 days of learning into a smaller learning. But every team, I can say, confidently embraced those learning modalities, and the one they chose worked with them. And if we couldn't help them, we found help for them. We are, as coaches, we are enablers. We were facilitators. We were the agents of change. We were there to help them with any of their needs. So Wave 1 started a long time ago, it seems, back in 2008. Wave 1 was only 3 teams. Then Wave 2 joined us, and we had 9 teams come in. I hear St. Mary's. St. Mary's was one of the teams that joined us in Wave 2. Owen Sound joined us in Wave 1. Clinton was Wave 1, and Strathmore was Wave 1. Wave 2 were, oh gosh, I'm not going to repeat them because I've missed some, but the 9 teams came in. But they had a benefit. Everything that Wave 1 did and learned and succeeded in and failed in could be transferred. Think of the benefits of collaborative. So Wave 2 could learn from Wave 1. And then we brought in Wave 3, and they came in, and we had a lot of new teams join us. So again, we had to transfer knowledge to them, and they were able to choose the way. Most of them were coaching only. So we went out, for instance, here in Durham and Chester. We went to them. But the benefit of Wave 3 was all the learnings and knowledge from Wave 1 and 2. So they could sort of reach into a pot and pull what worked and start to work with us. Collaboratives are very powerful learning tools and are very powerful ways to share information. So that's the other thing about P4H. It's all about sharing. It's all about the collaboration of the 70-somewhat doctors for the benefit of the 6,500 patients. Patients are at the center of this. We're going to affect change for them. So here's our recipe. I like to call it the recipe. Every dessert, a sweet success dessert, has a sweet recipe that goes with it. And Kelly, thank you for those good words about the Congress, because we too, as part of the Partnerships for Health team, we're really proud of what happened that day, because it wasn't about us. It was all about what the team did and their successes. What we were able to do for them was to give them a recipe. It's as simple as that. And the recipe has 4 components to it. And if you look up there, I'll go through each one of them individually. But we know through experience that we ourselves in Partnerships for Health, we have a great leadership team. We have Mike Hindmarsh, Mark McAllister, and Barb Willis, and Gavin Giles, who also support us as coaches. And they have forged ahead in many years ahead of us in terms of the knowledge they can bring to the table. So they bring this concept of the recipe to the table. So we'll go through each one of them, if that's okay with you, quickly. But you need to understand why we put them in the recipe pot. The first one was the clinical information. And we know through type 2 diabetes, we have clinical guidelines. Diabetes was selected for this initiative for a few reasons. One, we've got solid guidelines, which you can go to and strive to meet. There's a rigorous amount of research on it. And we also know that when you can apply the learning and work with patients, there is opportunity for good improvements to diabetes with children. So there's a manual here that has all of the clinical information. But key to it is the editor-in-chief is Dr. Stuart Harris out of London. He was part of our learning collaborative. So when this came up topically in the learning on what are these all about, we had him share that knowledge with all of our partners who were joining us that day. And if they couldn't come in person, we had videotape. So as I, as a coach, I could go out with his 50-minute lecture on these clinical guidelines. So we wanted to ensure the teams understood the guidelines that they were moving towards. Next on it is the Chronic Disease Prevention Management Framework. Now, this is in our website or on our website as well, explained, but in a nutshell, it's a model of integration and collaboration. It's a model that really asks for partnerships to be formed between primary care and the community care partners in the community. So when we were back up there talking about teams and you think of your community, so here in Durham, for instance, you have your physical team there with the physicians, nurse practitioners, RNs. We have a pharmacist. We have our CCAC colleagues. CCAC has brought so much to the table to the benefit of the teams and the benefit of our patients. In some communities, we had local pharmacists join us. In some communities, we had local physiotherapists join us, for instance, in Owen Sound. So think of the model of care. Chronic disease prevention management. Prevention management. We're talking about prevention and managing the disease. So how can we improve the patient through the integration of those people? That's what the framework is all about. And the teams, they're far be it from me, but silos did exist. I'll use it in the past tense. Did exist. I come from Bell Canada. I have 25 years experience at Bell Canada, and there was never a company with silos. It was Bell Canada. And it was hard to break the silos. So I came with a bit of a understanding of silos, but what I was mostly surprised about was how quickly these silos fell away, and how quickly the barriers fell away when the teams understood this model. So the chronic disease prevention management model is on the website, and if I don't have the opportunity to share more with you, I encourage you to look at it now. But it served its purpose very well for us.